March is Colorectal Cancer Awareness Month. This type of cancer is the third leading cause of cancer and the second leading cause of death.
We really do think about the colon and the rectum separately. There's many similarities, but in terms of some of our treatment paradigms, there are differences. And we also think differently about cancers that start on the right side of the colon and those that start on the left side. So what was once just one disease is now really thought about as many different diseases in the same spot.
Experts say they're starting to see more patients under 50 years old.
You know, we often think about this cancer and really all cancers as a disease of aging. But the incidence of colon cancer is declining in the 65 and older population and increasing rapidly in the 50 and under population.
Experts go on to say change could be the effect of people's diets.
So diets that are high in fat, low in fiber, high in red meat, increased alcohol consumption. There's concerns about changes because of this diet and perhaps exposures to antibiotics, both medically and through our food sources, how those all impact the changes in the gut microbiome.
And they say older patients have an easier time getting better after being diagnosed because of screening.
The reason why the older population is getting better is because of the value of screening, colonoscopies to find cancers before they become cancers. And although we have changed the screening guidelines for when to start, I think the uptake in the younger population is still not as good as it can be.
They also add that screening could be a barrier in younger patients.
Essentially a day and a half lost of work, right? Between prep the day before and then the day of the procedure itself. I think that can be difficult to do. And so if we can do that in the appropriate patients and do non-invasive screening in the other groups of patients, that would help.
Experts say they're usually diagnosed at a more advanced stage.
And the reason for that is, one, the nature of the disease, but two, symptoms are attributed to other more benign causes. And so I think the whole medical community has to be alert to the fact that if a young patient has new blood in their stool, new changes in their bowel habits, that needs to be taken seriously.
Now, some ways to reduce your risk of colorectal cancer: increase the amount of fiber in your diet. You should also limit the amount of red meats and of alcohol.